Hello everyone and welcome to the next lecture on pulp and periapical lesions. So we will be discussing this topic in two parts. So this is the first part of the lecture. So the learning outcomes for this topic under the DTS curriculum are as follows. By the end of the topic, you should be able to explain the clinical features of pulpal disease, explain the sequelae of pulpitis, differentiate periapical lesions based on their history, clinical presentation, and histopathology. So as we move forward, this lecture will stress on explaining the core concepts. And as you understand the core concepts, we will supplement this with the case-based learning that we will be doing on Google Classroom. And by the end of the topic, you will be able to get a holistic overview and proper understanding on this topic. All right, so this is a flow chart of showing you what happens as a sequelae of pulpal injury. So on the top here is normal pulp, which is asymptomatic. That means perfectly healthy tooth, which has no caries and no injury of any sort, has no pain or any sensitivity. That means the pulp is normal. Okay. Injury of any kind. Injury could be most common pulpal injury is due to caries. So caries that commences at the enamel, extends and goes down to the dentine, and from the dentine, the byproducts of the carious process stimulate a response in the pulp, which is perceived by the living tissue in the pulp as an injurious source. So this injury could lead to inflammation, right? And inflammation of any living structure is termed itis, and thus the word pulpitis. So inflammation of the pulp is called pulpitis. And two suffixes that you notice here are prefixes that you notice here are acute and chronic. So I would like to explain a very important rule of thumb here when we use the term acute and chronic. So we use the term acute when you have severe symptoms in short durations, right? So that means the patient has very severe symptoms of pain and the duration of the onset of this entire symptoms is very short. Then you call it acute, right? In any circumstances, in any inflammatory disorder, right? So acute pulpitis here means the patient has severe pain which is of pulpal origin, and this pain is very severe and has a very short duration of its onset. Whereas chronic, the word chronic is used as a suffix, as a prefix when the symptoms are mild and the duration is longer, right? So that means the duration of onset is longer and the symptoms are milder. That's when the term chronic pulpitis is used. So the difference between acute pulpitis and chronic pulpitis is basically the severity of the symptoms and the duration of onset. Right, so after inflammation of the pulp, what actually happens is it eventually leads to pulpal death and periapical inflammation. That means subsequently leading to periapical inflammation. So as we go forward, I will explain to you why actually the arrows that you see in this flow chart are all unidirectional. That means if there is an injury that occurs to the pulp, it leads to inflammation, and once it leads to acute inflammation or chronic inflammation, which is bidirectional, it eventually could lead to the death of the pulp or necrosis. Okay, so let's look at the pathophysiology. So any noxious stimuli could be chemical, thermal, could be bacterial. All right, that induces an injury to the pulp, causes hyperemia, that is increased blood supply. There is dilatation of the blood vessels. Along with that, causes edema and brings in the polymorphic neutrophils as a response. Now, the problem with this response with inflammation in the pulp chamber is that the pulp chamber is a calcified enclosed four-walled chamber wherein once inflammation sets in, it increases the intrapulpal pressure because of the edema that's coming in as well as dilated blood vessels, which leads to the degeneration of the odontoblastic process and formation of the pulpal abscess and progression of pulpitis further. Now, this is also the very reason why pulpal pain is so severe. That's because The intrapulpal pressure that constantly increases with the inflammation of the pulp is the reason why the perception of pain, dental pain, acute dental pain, is the most severe pain that is perceived by human beings as compared to any other pain. And that is also the reason why inflammation in the pulp is very different. The response to inflammation in the pulp is very different from that in any other part of the
Release of
body. Inflammatory mediators causing vasodilation increases blood flow and vascular leakage causing edema, which you are already familiar because this is common to inflammation in any other part of the body. Dental pulp undergoes pulpal inflammation, and because of the process where in this inflammatory process where there's increase in intrapulpal pressure, there is self-strangulation which takes place. The odontoplastic cells, they degenerate, and eventually the pulp undergoes a process called as pulpal necrosis. Right. So when we look at the word pulpitis, which is pulp inflammation, there are various different terms that are used. All right. The most common one is acute and chronic. All right, which is based on the severity of symptoms and the onset duration of onset. Right. Reversible, irreversible. Okay. Reversible pulpitis is when the injury that has caused that has been caused to the pulp is reversible. That means it can heal by itself or by intervention, and the tooth can and the pulp returns back to normal. Irreversible pulpitis is where the injury to the pulp is causes irreversible damage. That means leads to the pulp necrosis and death of the pulp. The third term that is used that you would come across when you read about pulpitis is chronic hyperplastic pulpitis, and we will see what that is. And the fourth is gangrenous necrosis of the pulp, which is the end stage of the process of inflammation in the pulp. Okay, so if we look broadly in terms of sequelae of dental caries, right, which I will further explain in the part 2 of this lecture. Sequelae of dental caries technically explains what actually happens once caries onset takes place. So caries that commences in the enamel, right, as we had read last time, that we've understood last time. For caries to occur, we need four major components. That's the tooth, the substrate, the microorganisms, and sufficient amount of time to interact. So the microorganisms are basically Streptococcus mutans, right? The substrate are mainly dietary carbohydrates, right? And they are fermentable, and then they cause the production of acids, organic acids, mainly lactic acids and many other acids, which cause demineralization of the inorganic substance of the tooth and destruction of the organic component, leading to cavitation. So that's actually in a nutshell what I have talked in previously. So this caries, as it progresses from the enamel to the dentine, right, as you know, through the dental tubules, the byproducts of the caries process, they percolate, they go down and cause inflammation of the pulp. So the term sequelae of dental caries is basically used to actually outline the pathogenesis of uh, various disease processes that can occur because of dental caries. So obviously dental caries commences in enamel, goes down to the dentine, then affects the pulp. We just realized that pulpal inflammation is unique and that once it sets in, it leads to irreversible damage. And once this pulpal damage takes place, it leads to it again further goes down, and then the inflammatory byproducts cause inflammation of the periapical tissues. And this periapical tissues, the inflammation of the periapical tissues, has various pathways of the spread of inflammation, spread of infection, and that is basically in a nutshell what is called the sequelae of dental caries. So I will explain the details of the sequelae of dental caries as we move forward, and specifically in part 2 of this lecture, right? So this lecture particularly we discuss and try and understand the concept of the pathologies pertaining to the pulp. So this is exactly what I said, right? I would like to give credit to some of these slides some of these slides to Dr. Vinay Marla, who was formerly teaching oral pathology at PIDC. So pulpitis is basically, as I told you, is inflammation of the pulp. It commonly occurs secondary to dental caries, and there are various reasons for it. It presents itself as a dull, throbbing pain, as blood pressure increases in inflamed areas, which I've just explained. Right? Causes of pulpitis could be bacterial infection, could be tooth fracture, could be chemical irritants, could be thermal factors, could be traumatic exposure, right? That means where person has had a road traffic accident or an acute injury where the tooth has fractured and the pulp is exposed, right? The reason why we perceive pain, all right, is because of the exposure of free nerve endings, right? So that is true for an ulcer, that is true for even uh, traumatic injuries here, right? So if there's a sudden trauma to your tooth, pulp gets exposed, right? So that is exposed to the irritants, and the irritation is perceived by the neurons and as pain. Okay. Any other conditions that can cause inflammation of the pulp is basically number one is aerodontalgia. Basically, when there is a difference in air pressure, it leads to perceived dental pain, okay, and inflammation of the pulp sometimes, and this is something that is experienced when you fly in an aeroplane, okay. The last one is iatrogenic. So sometimes iatrogenic is the term that is used when a particular disease process is caused due to medical or dental treatment. All right. So something that's induced by the doctor. So here in this case, sometimes when you are getting dental treatment done, if during the procedure, if there is an injury to the adjacent sound tooth, that could also lead to pulpitis and inflammation of the. Okay, so now let's try and understand the concept, the histopathological aspects of pulpitis. All right, so we've learned about reversible pulpitis. So here we have two images here on the slide. Number one is on your 2 o'clock position, which is a diagrammatic representation of reversible pulpitis. So here you're able to see the enamel, the dentine, the pulp as represented over here, and there seems to be a restoration that is deep and quite close to the pulp, which is seems to be the irritant here, and there is mild response. So this tooth currently is has reversible pulpitis. So trying to understand what exactly happens at the microscopic level. So in the pulp, what exactly happens is there is dilatation of blood vessels, all right, and there is a very mild inflammatory response that is seen, right? So at this stage, if this tooth, this restoration is replaced, all right, and it gives the pulp time to heal, and thus this is called reversible pulpitis, all right. So we could call this acute reversible pulpitis if the symptoms, that means the symptoms, that means the pain that the patient presents are severe and the duration is short, right? So I've explained the concept of acute chronic, we've explained the concept of what is reversible, what is irreversible, all right. So now we're basically understanding what exact correlating what clinical situation could be and what would be the histopathological correlation of the same. Irreversible pulpitis, on the other hand, all right. So this is a diagrammatic representation of irreversible pulpitis. Yellow is the enamel, the white, this area is the dentine, and this is the pulp. All right. So here there seems to be a restoration which has fractured, and there is a focal area of acute inflammation, all right. So this acute inflammation of the pulp, all right, leads to, is basically called pulpitis. We call it irreversible when this damage is going to lead to is severe and is going to lead to cannot be reversed, right? So what has actually happened over here is there is acute inflammation. So acute inflammation basically includes dilatation of blood vessels, hyperemia, and then there is polymorpho-neutrophils that actually come in over there to try and ward off the stimulus. So the blue thing is edema over here, this is the neutrophils around here, and these are dilated blood vessels over here, okay. So this is in response to a tooth with advanced recurrent caries. What's actually happening microscopically, all right, so this is the dentine, decalcified dentinal layer, this is the pulpal region. So what's happening is chronic inflammatory infiltrations there, there's lymphocytes, plasma cells, vascular dilatation and engorgement, right, and of course edema. So this is what happens in chronic irreversible pulpitis, right? So because the symptoms are milder and the duration is longer, So the acute inflammatory cells are replaced by chronic inflammatory cells. The other indicators of inflammation are all present, that is vascular dilatation and engorgement and edema. Okay, just to compare the pain symptoms in reversible and irreversible pulpitis for you to understand. So, on if the patient has reversible pulpitis, the pain is usually is elicited. That means when there is a stimuli, only then there is a certain amount of pain, and that pain is very sharp, less than 20 minutes of duration. The pain is unaffected by body position and is easily localized. That means the patient is able to tell you where exactly the pain he or she perceives. All right. Whereas in irreversible pulpitis, the pain is usually spontaneous. That means it may or may not require a stimuli, and it certainly arises. Okay, the pain is dull and is usually for more than 20 minutes duration. It is affected by body position. If I am to actually expect an answer from you correlating why it's affected by body position, obviously it's because as you have seen just now, histopathologically in irreversible pulpitis, there is edema in the pulp, right? And when there is postural change, the edema shifts, and thus there is pain that is elicited, right? Okay, that's the logical explanation to pain that's affected by the body position, change in body position. It's often difficult to localize, so the patient finds it difficult to localize. So this is how you differentiate reversible and irreversible pulpitis. Okay, so after the stage of irreversible pulpitis, what actually takes place, as I had explained, is cell strangulation and eventually pulp necrosis. So the odontoblastic process it degenerates, right? So what happens in pulp necrosis is that the pulp tissue has chronic inflammatory self-infiltrate, lymphocyte, plasma cells, as focal areas of pulpal tissue destruction. Okay, as is indicated by this yellow circle here. There's dystrophic calcification, as indicated by the basophilic areas here, and there's edema. Right. So this is basically the death of the pulp. Okay. Okay, so now let's look at a unique condition called chronic hyperplastic pulpitis. Right now, this is a type of pulpitis where there is a different response of the pulp tissue to inflammation. Okay, now as the name suggests, it's chronic. Okay, and hyperplastic means basically overgrowth of pulp tissue, and there is inflammation of the pulp that takes place. So secondary to inflammation of the pulp, there is hyperplastic pulp tissue that grows in these lesions, and it's chronic. So it's also known as pulp polyp. It's commonly seen in deciduous teeth or recently erupted permanent tooth, right, as is seen here in this picture, which have wide open cavities. All right, so wide open carious lesions where there's a pulpal inflammation. All right, and there is a reddish tissue mass that's protruding beyond the boundaries of the pulp chamber. So if you see a large cavitation with a central mass in the rising from the pulp chamber, then it's most likely pulp polyp, and this is commonly seen in young adults. Okay, so the pathogenesis of this lesion is that it occurs in response to low-grade chronic inflammation. Okay, so wide open pulpitis prevents the buildup of tissue pressure, compromising the blood flow, right? So that intrapulpal pressure does not increase. Instead, there is sufficient amount of collateral blood flow that the pulp is able to develop, and this blood flow gives the pulp uh, time to develop a response. And the response of the pulp tissue to this type of chronic inflammation is basically a hyperplastic response. So there is, if you look at this diagrammatic representation, what happens is through that opening of opening of the pulp, there is pulp tissue that is actually growing out. So this is basically hyperplastic pulp tissue. So this is very unique, is seen only in certain cases. All right, the reason behind this is basically the increased vascularity of young deciduous teeth, right? Young permanent teeth or young deciduous teeth in children. Okay, so histologically you see a plastic dilatation tissue, increased vascularity, and sometimes it's epithelialized. So this is again diagrammatic representation of the same. You're seeing enamel, dentine, a wide open cavity here, exposure of the pulp, right? And the pulp basically has a hypoplastic. So this is a clinical picture here. Again, another clinical picture showing you centrally the pulp polyp. Radiographically, this is how it looks, right? So this is an unerupted second molar, right? The first molar shows a large cavitation with exposure of the pulp. Clinically, there is a polyp that is attached to the pulp, as seen in the clinical picture on the previous. Microscopically, right? So what does it see? Many a times we see hyperplastic stratified squamous epithelium lining this pulpal tissue, right. So this pulpal tissue that is actually protruding out of the pulp chamber is mainly composed of something like a granulation tissue, and granulation tissue basically is composed of connective tissue, chronic inflammatory cells, and dilated blood vessels, which is what you are able to clearly see in this image. So this is the epithelium, this is the dilated blood vessels that you're able to see. This is the chronic inflammatory cells that you're able to see, all the numerous blue dots that you're able to see. Okay, so this is pulp polyp.